wait, you're back.
You're back.
Okay, good. Yeah, my service in my room is really spotty, and then if I move to anywhere in that house, like it'll be cut off completely. So after some technical difficulties when setting up my Zoom call, I was able to sit down with Stephanie Cutler, a licensed clinical social worker, and ask her what advice she has for students struggling from the impact of the COVID-19 pandemic.
Definitely trying to keep some semblance of a schedule, even though you may not be leaving your home. So getting up and showering and putting on day clothes, or making tea or making coffee or making breakfast, sort of making yourself a morning routine versus rolling out of bed and like scrambling to get on for class. Having that structure can help to sort of set you up for the day in some kind of way. And keeping as consistent as possible with that. It gets easier over time, even if it feels kind of rough the first couple of days. Now, with that being said, if you can't, and if you're having a hard time doing that, my second point is to practice a lot of self-compassion. So if you're not able to function as much as you were before, to not beat yourself up about that or tell yourself you should be able to do that, or other people are doing it, why can't I do it? But to practice gentleness and compassion and understanding that some days might come easier than other days.
All right. Lauren, can you introduce yourself to the crowd?
Sure.
I also sat down with Lauren Atkinson, a Texas Tech University student, as well as a student who seeks therapy on a regular basis, to discuss her advice that she has for students who are feeling overwhelmed with the impact of COVID-19.
I think there's a lot of different things that students could do. Some of my favorites have been just going outside and going for a run, or like working out in a park, because those things are things that are extremely safe to do. You don't have to get around other people or anything. But also journaling, helps a lot. Just getting some of those internalized thoughts out on the paper and expressing those. There's so many different coping mechanisms, but some of the biggest ones are just doing things like FaceTime, trying to still have some type of semi-normal human interaction, and finding a reason to leave your room. Like I tell my residents, I'm like, well, find at least one reason a day to get out of your rooms instead of just like staying in there studying, whether it's to go get food, whether it's to walk around, it doesn't matter. Just try not to completely isolate yourself, even though that's fairly easy to do at the moment.